Hello everyone, I'm Dr. Tushar Mehta, an orthopedic surgeon and a faculty of orthopedics at AIIMS. First of all, I just hope that all of you are safe at your homes, and please do take care of yourself and the people around you. So this small snippet, this small video is basically regarding the questions that have been asked in the recent AIIMS exam of June 2020. So I will be coming up with a series of video solutions of all the questions that have been asked, and we will discuss maybe certain related things as well. So in that effort, the first question that I'm going to discuss is, probably if you remember, there was a question around the meniscal injuries, the tears, and something related to their vascularity. So what was the question that we'll discuss later on, but let me just give you a brief overview of the topic. I'm sure on your screens you can see something written there that is called meniscal blood supply. So menisci are semicircular oval structures. They act as cushions in the knee, they act as shockers in the knee. When you walk, jump, run, you do anything, your body weight goes onto your knee, and that weight is actually taken over by the menisci. Now when we talk about their vascularity, you should know that this outer one-third that you are able to see here, this is basically the vascular zone. So that is why they have called it red zone. While the inner part that you see is basically the avascular zone, and that is why they call it the white zone. Now the interesting part is that in between the red zone, that's the vascular zone, which is the outer one, and the inner avascular white zone, you have an intermediate zone, which they call as the red-white zone. So outer zone is called, I'm sure you can see that outer zone is called as red zone, the inner zone is called as white zone, and the middle zone is called as red-white zone. Now after this blood supply, let me just make things a little more clear to you. You have to understand that the menisci get their entire vascular supply from the lateral and the medial geniculate vessels. Of course, they do give superior and inferior branches, that's important. But what is more important is that the medial and the lateral geniculate vessels are important. But now you have to understand that the superior and the inferior branches from the medial and lateral geniculate vessel, they combine together to make something which is called as PMCP. What do you mean by this PMCP? PMCP means perimeniscal capillary plexus. Now the perimeniscal capillary plexus, which is formed by the medial and lateral geniculate arteries, they enter inside the menisci from synovium and all those things. They enter inside the meniscus, and the vascularity enters from the peripheral part. You have to understand that. The diagram here is very evident of this particular thing. I'm sure you can appreciate that as well, that vascularity is entering from the peripheral part, the outer part. The PMCP is entering from the outer part, so making the outer one-third as a vascular area, or what you call as a red zone. Now there is one more thing that I want all my students should know, that entire meniscus is vascular at birth. Alright, so when we talk about at birth, so entire meniscus is vascular. Okay, so when by 9 months of age, there is only inner one-third that loses its vascularity. So I feel that embryologically it is a very important point that there is no distinction at the time of birth. The distinction that I've told you, that is something that we have right now. At time of birth, entire meniscus is vascular, but as time advances, the inner one-third loses its vascularity. In adults, and you and me, the outer one-third, that is the outer 10 to 30% is vascular. Now, how is that important as compared to, or maybe as connected to the healing? Whenever a meniscal tear happens in the red zone, that is the outer one-third zone, that is the peripheral vascular zone, the chances of healing are better. Why chances of healing are better? Because you should know that for a meniscal healing, the formation of clot is essential. And that is possible only if you have a vascular zone tear. So that is why tear in the red zone, I've written here, tear in the red zone, they are most likely to heal because the clot formation is very essential. So therefore we would like to conclude it like this, that a tear in the outer one-third, the peripheral vascular zone, has got a better chances of healing as compared to the inner one-third white zone tear. Again, with the help of this diagram, I've tried to show you the things again. So you can see the PMCP, the perimeniscal capillary plexus, entering inside the knee joint, which is formed as a contribution from the geniculate vessels. Now, keeping the red zone as a vascular zone, alright, the red zone is completely kept as a vascular zone, and then you have the red-white zone, which is a combination of both vascular and avascular zone, and then the complete white zone, which is a complete avascular zone. And tears in this white avascular zone are very notorious to heal, that usually don't heal. Now, as an orthopedic surgeon, couple of things are pretty clear to me. This zone tear, I will try to repair it, meniscography. While if there is a this zone tear or this zone tear, I would like to prefer for a surgical treatment of meniscectomy, because I'm not expecting much of healing. All right. So if there is a white zone tear or a red white zone tear, I'll prefer a meniscectomy. But if it is a red zone tear, then I will definitely prefer a meniscal repair, that is a meniscography, because chances of healing are pretty high. Alright, so this was a discussion of the first question of AIIMS June 2020 Orthopaedics, and I will be coming up with more video solutions of this paper very soon. Stay tuned to more videos, and thank you so much and all the best, and I hope that all of you are back on track with your studies and preparing for November, December and the coming exams. And thank you so much again. I would like to wish you a lot of safety at your home and take care of your people around you. Thank you so much, and please do wear mask in the open areas. That's important. Thank you.